Hi, my name is Jake. This is the week 5 skills module. This is part 2 trach suctioning. And there's my badge. And with that, we'll start. So upon entering the room, we're going to do hand hygiene. Hi, my name is Jake. I'm a nurse here at Champlain Hospital. Before we begin, can you state your name and date of birth? We're going to be checking his name badge. Everything comes back okay. Hi, Mr. Shoemaker. I'm in here today to check up on your tracheostomy as well as assess your lung sounds. Do you have any questions? No? Okay. Before we begin, do you have any allergies I should be made aware of? No? Okay. And are you currently experiencing any pain? No. Alright. So we're going to assess with our stethoscopes the lungs. If we do need to do suctioning, it's going to be crackles / kind of wet noises. So, Mr. Shoe Bottle, it looks like I will have to do some suctioning today. This procedure should only take 5 to 10 minutes. Do you have any questions? No? Okay. So, before we begin, we're going to do some hand hygiene because we've been touching around and stuff like that. We're going to open up our sterile saline as well as turn on, this is our suctioning, our wall-mounted suctioning. To 100 to 120 millimeters of mercury. We're going to do hand hygiene again because we touched more stuff. And we're going to open up our sterile pack. Because I had to repack it, it's kind of touching the sides, but normally it wouldn't. We're going to open up and put on our sterile gloves. I think you can see that pretty well. Alright, so we're going to only grab the cuff, put on that, and go underneath the cuff on this one. So now we have sterile gloves on. Now, for this procedure, we are going to have to contaminate one of our gloves, and that's going to be my left hand, because that's my non-dominant. And so as we're still sterile, we're going to take out our actual suctioning and wrap that around. Now we're going to contaminate my hand by taking our sterile solution and pouring it into the box. We're going to pretend like I made the box when my hands were sterile, just for this video. So now we have a reservoir of saline in there. Next, we're going to plug in our suctioning without touching our contaminated hand with the actual suction. So there we go. Now to make sure it's okay and working, we're going to suction our reservoir, which is good because we know it works now. And now we can begin actually suctioning. So I did forget to take off the mask. I guess I could do it with my contaminated hand and just keep it close by. But that was a supposed mistake on my part. So now we can begin suctioning. So we're going to insert without having our thumb on the suction into the tracheostomy without touching our sterile glove to the actual tracheostomy. And we're going to keep going until we hit resistance. We're going to come out a little bit so we're not giving his trachea a hickey. And we'll begin suctioning. So and we're doing just little bits and rolling around. And there we go. So that's one done. We're going to wrap this. And we're going to, this is our ambu bag. And we're going to give Mr. Shoe Bottle here some oxygen. Next, we're going to unravel this and clear it out. So suctioning in some saline, and in some cases we do this up to twice. We're going to do that here. So we're going to insert it, again without touching our sterile glove to the tracheostomy itself. Go in until we hit resistance, come out a little bit, and then start suctioning. So there we go. And again, we're going to give Mr. Shoe Bottle some oxygen with our ambu bags, so breathing in. And there we go. Next, we'll unravel again. Put some sterile saline through. And now we are good to go. So while we're here, we're gonna actually probably put back our trach mask just so he can breathe normally. We're going to unplug this, grab it with my glove. There we go. So now it's inside our glove. I don't know if you can see that. And there we go. We're gonna do hand hygiene. Mr. Shoe Bottle, is there anything else I can do for you? He also now has his O2 mask back on, so he should be breathing normally. His O2 sats looking normal. We're gonna dispose of all our equipment in the proper receptacle and per protocol. And with that, that will do it. So thank you very much.